It's true, when we go home, we're going to hear an earful. I'm going to hear an earful, I bet, from young Caleb, a boy, Mr. President, who was born with legs that stopped here, right above his knees, who's needed a set of new prosthetic devices because the rest of his body's growing. But the insurance company says no because he had a pre-existing disability. I'll get an earful from Caleb, and especially his parents, an earful of joy and happiness. Because you see, Mr. President, from this day forward, insurance companies will not be able to deny coverage because of pre-existing disability. People like Caleb and parents who have children with diabetes and other problems, it's over with. So yes, we will hear an earful, but it's going to be earful of wonderment and happiness that people waited for a long time. This morning is not the end of the process. It's merely the beginning. We'll continue to build on this success to improve our health system even more and to further ease the terrible burdens on American families and businesses. But that process cannot begin unless we start today. We may not completely cure this crisis today or tomorrow, but we must start toward that end. We must strive for progress and not surrender for want of purity. Our charge is to move forward. This is a tradition as old as this republic, one that has always comprised interests and opinions as diverse as the people who populate it. Our founding fathers did not promise to form an infallible new nation. They promised instead to promote the general welfare as we move toward a more perfect union. They valued progress. Our nation's earliest leaders promised not absolute happiness, but only the pursuit of that goal. They valued opportunity, and like other new programs that improve the lives of many and were since strengthened to improve even more, programs like Medicare, Medicaid, Social Security, progress and opportunity are what this historic bill represents. To those who so admirably care so much for their fellow man that they demand more, I say, this is just the beginning. With Senator Ted Kennedy's voice booming in our ears, with his passion in our hearts, we say, as he said, the work goes on, the cause endures. Opponents of this bill have used every trick in the book to delay this day, this moment. And yet here we are, minutes away from doing what many have tried, but none have ever achieved. We're here because facts will always defeat fear. And though one might slow the progress, they can't stop it. And though one might slow the speed of progress, its force cannot be stopped. Mr. President, I'm sorry to say that for the first time in American history, a political party has chosen to stand on the sidelines rather than participate in great and greatly needed social change. I'm sorry to see that many on the other side have resorted to myths and misinformation and continue to rely on them long after they were debunked. And it's regrettable that they view our citizens' health care through a political lens, because affording to live a healthy life isn't about politics or partisanship or polling. Mr. President, it's about people. It's about life and death in America. It's a question of morality, of right and wrong. It's about human suffering. And given the chance to relieve this suffering, we must take this chance and deliver on a promise the American people have deserved for 6.5 decades.
The yeas are 60, the nays are 39. H.R. 3590 as amended, the Patient Protection and Affordable Care Act is passed.